Welcome to Integrate Online, presented by West Virginia University, Reed College of Media. I've got my little gnome here. You know, the WVU offers renowned online master's program in marketing communications. If you haven't checked it out, you really should. It's a great program. I happen to teach in it, so I speak from experience. Thanks for joining us. Today we're going to discuss communicating and fundraising in the midst of physical distancing. We have with us a great panel. Leandra Clovis, Senior Director of Walk to End Alzheimer's, Chuck Harman, Chief Development Officer for NAMI, and Nicole Riggleman Kelly, Major Gift Officer at Children's Hospital of Pittsburgh Foundation. I'm Kristi Hansen Onkka. I've been in healthcare marketing for 20 years, and the last 3 years I've focused on augmented and virtual reality for healthcare. So I'm really excited about this conversation because we've had to change a lot of the way in which we communicate using more virtual means of doing so. So I'm excited to talk about how that's been going with our panel. For everyone on the Zoom call, please be sure to keep your mics muted for the whole session. And if you do have any questions, just send them through the chat feature and we'll get to them towards the end of the session. Okay, so let's start with our first question. Recently, everything came to a stop. We're in a great recession, but fundraising must go on. And matching grants could be lost without individual and corporate donations. So I'd like to ask each of our panelists, how has COVID-19 impacted meeting your fundraising goals for this first half of 2020? And I think we can start with Leandra.
Hi, everyone. I am Leandra Clovis, and like it was said, I'm the Senior Director for Walk to End Alzheimer's, so I oversee our Walk to End Alzheimer's and peer-to-peer fundraising for all of Central and North Florida, so from Orlando all the way up to Pensacola. So happy to be here with everyone. And I would just say that for the first half of the year, it's definitely been an interesting time for us, but I don't think the greatest impact, at least in our situation, has been for this first half of the year. I think where we're really having to adapt and start to think is about long term, but from a peer-to-peer fundraising standpoint, when we're talking about corporate donations, we're looking at a lot of sponsorship. And so we had actually had a really heavy sponsorship push in January and February that luckily in our case had kind of set us up. And we had raised what we normally raise through June as early as February this year. So I definitely think when it comes to walks and peer-to-peer fundraising events, we were in a little bit of a unique situation where we had kind of just skirted in a heavy corporate ask, and where we're really having to be flexible is when we start thinking long-term into the second half of the year. So for us, not quite as heavy as an impact so far.
Okay, thank you. Chuck, what about you?
Well, good afternoon, everyone. I'm Chuck Harman. I'm the Chief Development Officer at NAMI. I'm on the adjunct faculty at the Reed College as well. Just a little bit about NAMI so you understand the context and some of the answers to my questions. NAMI is the largest consumer mental health organization in America. We have 650 local chapters or state organizations, and then the national office. We're all independent 501c3s. So it's a broad umbrella for a lot of the country. There's no doubt that COVID has been a major disruption in so many ways. And I do think our grassroots organizations have been the hardest hit of any of the levels of NAMI. The biggest thing that we've done is made a pivot. And I think at all three levels, we found ways to do things in a different and unique way. Our major donors have really stepped up, and a few in particular who really came in at very high levels. We also created a mental health support fund, a COVID mental health support fund, and have seen great impact from that. And our corporate and foundation donors were very supportive as well. finally, I'd just say that, and we'll hear more about this, but the live events, transforming the live events has probably been the most challenging of all.
So Chuck, have you been able to, has this impacted your goals like in this first couple quarters?
Well, it depends on which part of the organization we're talking about. So
okay.
We're doing pretty well. The states are varied and the grassroots are varied, but I would say the grassroots are hurting the most.
Okay, great. And then Nicole, what about you?
Hi, so it's interesting. So we are on, our fiscal year ends June 30th. So we had about 9 months that were good, I guess 8 months. And then a lot of our events are in the spring. So we have our annual Walk for Children's that's supposed to be June 6th, and it is still happening, but it's switching to a virtual event. So while some of the corporate sponsorships have come in, then we're in the situation where we're looking at the individuals who generally raise money for their teams. We too are also looking at long-term, what it's going to look like. We had a good fundraising year until we hit March, and you were pacing ahead of goal, and then COVID hit, and we've had to pivot as well. We have a helpers fund that was for our frontline staff, and to do some community outreach with some of our children's locations that are in the community. So it's really been it's going to be interesting as we end June. There'll be areas that we hit our goals because we were there before this hit. And then there'll be areas that we need to also look at the future in terms of particularly events and how we're going to pivot those moving forward, because I really think that there's going to be some level of virtual as we move forward, whether we, hopefully next year for the walk-in 2021, we can all be back in person, but I think we're all learning a lot as we look at how our donors are responding, and some are not going to be as comfortable as others, and it's gauging where the donor's comfort level is as well.
Okay, well that kind of brings us to the next question. So, if you're retooling these events or retooling the way you communicate, has your team adapted? How have you restructured or retrained them, especially in a landscape that's continually changing? Nicole, do you want to take that? You're on mute. Oh, there you go.
Am I unmuted now? The joys of technology and all of us still getting used to this. So at Children's, so we have the hospital's communication team, we have the foundation's communications team, and then we have gift officers like me who work directly with individuals. So when COVID hit, the hospital's communication team is the outward facing, communicating with patient families and the community at large. As the foundation, we were looking at how do we make sure our donors still feel connected and understand whether they're parents, what they need to do with their kids, or just donors in general, so that we can be good stewards of their philanthropy and of their gifts. And one thing we did early on was a town hall with our hospital president to allow donors to ask questions about COVID, the impact on the hospital, and what to expect from their families. And moving forward, we're doing a series of those. So we're having to pivot on ways where we would have had in-person events. We're pivoting to create virtual experiences where donors still feel connected to hospital leadership, while still maintaining the outward facing on the hospital communication, and then the internal foundation with our donors as well as external foundation, if that makes sense. There's a lot of audiences, and I'm sure everyone else feels you have to take a little bit of a different approach, but we want to make sure that everyone feels important and informed on where we are, especially as rapidly changing as healthcare is right now.
Great, thank you. And Leandra, how have you adopted new procedures with your team, or how have you retrained your team to respond?
Yeah, very similarly. So I oversee all of our development managers for the state, and they have their own portfolios with their walks. And I think that the main key that we've taken on as the Alzheimer's Association is just that one-to-one communication is vitally important. So my staff are used to communicating with their donors, but we've kind of taken it up a notch, and we really have increased that one-to-one communication. So we have called all of our walkers and our team captains and everyone like that individually, which, you know, we do in normal years, but we have definitely done it more often since March. And we really have wanted to put them first. So we've kind of had to retrain ourselves momentarily to get out of fundraising mode and really into just checking on people and that cultivation mode. And we very heavily focused on that for about a month. And so we are kind of back into our normal, you know, walk and having these virtual events and starting to talk fundraising. But it was after a very conscious pause to just make sure that people were okay and to lead with that into whatever we were doing. So like Nicole, we were on track for probably our best year in quite a few years. And so we were really heavily into fundraising and go, 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 go. So that was a transition to kind of breathe and step back and make sure everyone was okay, make sure our teams were okay. And we also are focusing heavily on virtual events as well. So just trying to make sure that people know what we're doing is highly important. We're also doing like weekly team captain kind of meetings where our donors can come in and hear about the things that we're doing. Because in peer-to-peer, we're in that unique space of we're not asking the donors directly for their donations. So we have to make sure that our team captains and our walkers are just as educated on what we're doing as we are, so that they can tell their friends and family why they should still support the Alzheimer's Association through Walk to End Alzheimer's or the Longest Day or whatever peer-to-peer program it may be. So we've really had to transition into a lot of educational kind of like Zoom calls and drafting more, you know, social media posts that are talking about the things that we're doing in the state, and just making sure we're being really transparent with our donors and that they know what we're doing at this time so that they can then communicate that out with others as well.
Yeah, it sounds like a lot of over communication is necessary in this time.
Yes, that's the best way to put it, probably.
Yes, okay. And Chuck, how about your teams? Have they been doing anything differently?
Well, I have a team of 10, and the interesting thing was that 3 of us are remote employees already. And I think the 3 of us decided that we could get through this. We understood how to work remotely, but the challenge was we didn't know how to work with everybody else that was now remote. So it was actually a learning experience for us. And, I think we took a more systemic approach rather than by function, rather than saying development has to do this, fundraising has to do this, communication has to do this. And I think the things that we did relating to COVID were more organization-wide. So to give you an example, we formed an interdepartmental COVID team. We did town halls that occasionally dealt with fundraising. We did Ask the Experts webinar that we had 5,000 people on a webinar where we generally get 900. The other thing we did was looked outside of our own internal capabilities to friends and others. So we utilized the media a lot, and we became a source for the media at all levels. And we teed up our medical director and our CEO and others to do a lot of national media work. We also called on our ambassadors, who are a lot of celebrities and sports figures, to work with us and engage. And the final thing that we did that I think has helped the organization is we do a weekly report that looks just at our space, just at the mental health organizations in national mental health organizations, and compile a weekly report about what they're doing. And that helps us, it's really in some ways a gap analysis that helps us determine what needs are being met out there. If we have a new idea, we don't want to recreate the wheel, but maybe there's a gap. So it's more a systemic approach.
Great, thank you. And I just want to remind everyone in the session that if you do have a question, you can write it in the chat and we will address that question. I want to switch now to talk specifically and get kind of tactically into these live events that are now virtual events. Nicole, can you tell me a little bit about what you guys are doing that you would normally do live?
Yeah, so a couple of things. First, we have our Walk for Children's, which we'll see in 2 weeks how that goes, but everything so far is looking good. Whether normally it's an event that raises about $800,000-900,000 a year for us, and right now we're sitting closer to about 500,000. So I think we'll see in the coming 2 weeks what that's really going to look like. I think there are a lot of lessons to be learned. Another tactical idea, and I mentioned it briefly with the town hall, prior to this, we had been doing education sessions featuring some of our doctors and researchers on projects that we were fundraising for. And a lot of those had been in person. We had tried one that had a virtual component. Now everything has switched to virtual. And those have been really well received. Most of our donors are in Southwestern Pennsylvania, but we do have some in Florida and New York and on the West Coast. And this has offered us a new way of really engaging. And it's interesting because a lot of times the physicians are so hard to get time on their calendars, and we're actually finding it so much easier. I have a donor meeting tomorrow, and 2 doctors are able to hop on the call because it's virtual and they have a 1-hour time block. Whereas before, when we were doing things with donors, it was get them to the meeting. And, so I think we're learning a lot. I think coming out of this, there's going to be a hybrid between what we did before and the new normal, I guess you could say.
And how do you think that hybrid will be? I mean, specifically for your live walks, what are you having people do instead right now?
So everything right now is pretty much the same, where they do the online fundraising page that they share on social media. The big difference is going to be on that Saturday, not being able to all join together in one place. We too had already had a lot of our corporate donations come in for this event. Now, the difference is some of our events that are later in the calendar year, those corporate donations were not in yet. So I think we're still navigating that. As far as the logistics of the walk, everything right now looks the same. The difference is going to be on that Saturday. We're doing a virtual kickoff, and then there'll be a social media hashtag that walkers all over will use, and we'll encourage them to share their photos and things with us.
That's great. And Leandra, what about your walks? What are you guys doing? Is it different or the same?
So at this point, our walks are not later until the fall. So we have not fully transitioned to virtual yet, just with the unknowns that are there. So we're kind of taking everything piece by piece. So some of the biggest things that we have moved so far is obviously we have a lot of wraparound events that go with the walks. The biggest ones would be like our past team registration event that should have happened around this time. And so normally we invite people to like restaurants to come and pick up fundraising resources and meet with us and maybe have prizes and things like that. And obviously that had to look a little different for this year. And that did transition into a fully virtual event that was actually nationwide. And honestly, it's one of those things where we look at it and have to think that maybe virtual was a blessing in disguise. Because it ended up being a really unique event that normally would not have been able to happen. So our CEO spoke nationwide, and we had a few celebrity speakers who work with events across the country. So people who aren't normally exposed to hearing those people get to speak in what feels like a more personal setting, even though it's, blue jeans and it's not really one-to-one, but it just feels a little bit closer. They were able to get to hear our CEO and for him to talk about our programs. And it was very mission forward. So that was something that had to kind of transition completely and wasn't going to be able to look anything like it normally looks, but it ended up just fine. It ended up unique, and it ended up being something that might stay around in the future. Who knows? It was successful. We had a lot of people call in. Another big factor for us so far has been our committee meetings and just our personal outreach. So right now we're not doing anything in person. So any one-to-one sponsors or new teams or new constituents, new volunteers, anything like that is happening either by phone or by Zoom. And so that has been a little bit of a learning curve, I think, for everyone, just because when you're getting to know a volunteer, you're not getting, you know, that one-to-one contact and meeting them for coffee and just getting a more personal sense of, you know, who they are and their personality and finding that role. So that's been a little bit unique. And, but I mean, even with all of that happening, we still are getting volunteers coming in. We're still signing new teams. We're still getting sponsorship requests. So, you know, people are able to transition to virtual and it's working out well. And then our committee meetings are another one where we're hosting those all by Blue Jeans and Zoom. And so we're not getting together and they've been working out fine. And I think, like Nicole said, as we move forward into the future, I don't think we'll ever go back to a traditional just in-person committee meeting. I think there will always be a call-in or a Zoom. Like, there might be a meeting and there might also be an option to dial in. But in a lot of our areas, we're seeing committees that are coming from across, you know, large metropolitan areas. They're not able to get across town for a 6 p.m. meeting. And so for some of our events, we're having better attendance for some of our committee meetings than we've ever had before because they're able to participate at their own pace. And so I just think paying attention to that kind of stuff, you know, we've been forced into this virtual world. But there's so much to learn from it. And some of these things that we thought would never work are actually working out better than they ever have before. And I think that there are pieces that we'll be able to keep with us moving forward to make our events even stronger, you know, looking into 2021 and, you know, onward. I think there's so much to learn from this year, even if it doesn't look like it traditionally has in the past. And so that's where we are right now. We're transitioning things virtually. We're trying to figure out what works and what doesn't and take that with us into the future. And for our events, as of now, you know, we're still moving forward with Walk Day. But I think a huge thing for that for us is we're having to really retrain our brains as to how we talk about Walk Day. So as Nicole mentioned, you know, the Walk Day, that Saturday morning itself is going to look a little different. And so we're so used to just kind of using that when we sell these live events. You know, we use the experience of the day. We describe what that day is going to be like. And if you have any unique opening ceremony factors, I mean, we really weigh heavily when we're trying to sell someone on a live event as to what that live event is going to look like. And we can't do that this year because even if we're saying that, you know, our events are happening as planned, we've all learned through 2020 that we have no idea what's going to happen in even a month's time. And so we don't want to bank on the experience of the actual day when we're not 100% sure what that's going to look like. So we're having to really retrain ourselves as staff to focus on how fundraising, and it's never about, you know, Walk Day. That Walk Day is just the culmination of fundraising and the celebration of what we've done for the Alzheimer's Association and for programs and research and services. And so we just have to really lead with, you know, we get a lot of questions like, if I'm not raising money for Walk, well then, and Walk doesn't happen, then what am I raising money for? And that's a big red flag. You know, you were never raising money for Walk. And so we have to really kind of retrain ourselves and just be very conscious of what we're saying to make sure that we're always leading with mission, that we're focusing on that Walk can still happen even if it looks differently, or whatever your event may be, a gala, you know, DIY fundraising, anything like that. It can still happen. It might just look slightly different than it normally has in the past, but it's still a cultivation and or a culmination of all of your fundraising efforts up until that point. And that really needs to be the focus. And so that's been a huge shift, I think, for us.
That's really interesting. And Leandra, you know, since you're still kind of planning out maybe an in-person walk in the fall, we actually have a question from the audience here. If you're going to have an event in person, what are the safety parameters that you'll take to help ensure a great event? Are you already planning the logistics around masks, sanitizers, et cetera?
So yes, that's a great question. So like Chuck had said earlier, our organization has also taken a really big look into everything that's going to happen. And so they put together a nationwide task force. And so they have people from across the country, from different states that are, you know, being impacted at different levels. And they are looking at exactly those things. What would the impact look like for our constituents if they had to come that day? So they're actually working on a full-fledged walk plan that takes into account all of the CDC guidelines, all of the different state parameters that we might have to go through, and then also really leaning heavily on like our head researchers. Obviously, as the Alzheimer's Association, we have, you know, a lot of medical experts who are really high up in the organization. And so they're leaning heavily on their expertise to figure out what would that have to look like if we have a walk day experience. But another thing that we just did recently is they also polled a lot of our walkers about their comfort level and ideas for virtual fundraising as well. So trying to figure out, you know, we can have the most amazing plan that is perfectly laid out, but we need to find out, are people going to be okay with that plan personally? So that's the stage that we're in right now. So we're collecting all of that data and putting together a plan, that nationwide task force that will put out all of that. But right now we're still moving forward with walks. We will have all of those guidelines taken into account. And we're just kind of taking everything one piece at a time in our walk timeline before making decisions.
That's great. Chuck, what about your team? You said that, you know, obviously some of you had to go start working remotely, and so there was that transition. But are there any events that you normally would have done that was more with the public involved that were live that now you're switching to a more virtual event?
Yeah, there's three that I can talk about. One is our national walk, same as the other organizations. We're doing one national virtual walk later this week, so that's very standard, I think, and hopefully will go along very well. The big event was our national convention. This is our 40th anniversary. We usually get 2,000 people at our convention. And so, you know, we have a vulnerable population, and we made the decision to go virtual with that event. And I think someone mentioned that, you know, sometimes you have to look for opportunities, and you have to find ways to make not only the best out of the situation, but, you know, innovation that might come out of these things. And so we're looking at doing it remotely. I will say it's interesting. Finding a vendor is very difficult now because they are so busy putting these things on. But one of the advantages that we might have is enabling populations of individuals who never could attend a NAMI convention before to participate now. We plan to keep the registration fee very, very low. Since it's virtual, there's no travel involved. And so we're looking at options like that which could really enhance the organization and open up access to these kind of things to communities that may not have had access before. And the third thing is an exciting thing that's going to happen later this week. I mentioned how we've called on our ambassadors and friends to engage with us. And we have an event called Stronger Than You Think, which is a live stream, May 27th through the 29th, 3 days with a huge number of celebrities like Taraji Henson and Howie Mandel, Kelly Osbourne, the list goes on and on. It's focused on youth. It's both entertainment and education and support for these, for youth mostly. So we're really excited about that. And that is something that came about as a result of COVID. We were not planning this event in advance, and we were asked to participate. So it should be good.
I'm curious if you were trying out any kind of virtual engagement strategies prior to this that you found are now super essential that maybe you were just dabbling in before.
The biggest area is that NAMI provides 10 education programs about mental illness. One is called Family to Family. So they're courses that people come in, families or individuals living with mental illness. Quite frankly, they come to a church basement. There is a peer, somebody who has lived through the same experience that's teaching this course. and what we have been doing is trying to move those programs to have an online or virtual component to them. We've already moved 2 programs in that direction, and the participation has skyrocketed. You know, the incredible amount of engagement. What we want to do is find ways to do that with the other programs, and we will do that. It's just a matter of time. So it's really more on the program side. And we did do a survey a couple years ago, and the interesting thing was that we did find people were okay doing some remote, but for people living with mental illness and their families, they really wanted that personal in-person connection, which was really quite interesting, although it makes sense with the isolation, social isolation that goes on with mental illness. But I think this will enable us or push us to move in that direction much quicker.
And I'm curious, for your events or any of your corporate donors, are any of them pharmaceutical companies?
Some are, but not all.
Okay, so we have a question from the group about pharmaceutical sponsorships, and have you seen a virtual event being sold to a pharmaceutical company as an option?
Well, we don't sell them. We have very strict guidelines, so there's no. It's not a promotional effort. We do engage in sponsorships, which could include a pharma company, it could include a healthcare company, or quite frankly, it could include a non-healthcare. But yes, those companies have been engaged.
And have you seen that they're pretty responsive as they would have been prior?
Yeah.
Or are there any reservations from it being virtual, probably recorded, anything like that coming your way?
No, they've been great supporters.
Okay, thank you. Okay, so I want to ask the same questions to Nicole and Leandra. Was there anything that you guys were dabbling in prior that was more on the digital or virtual means of communication or engagement that you find has worked really well now? And Leandra, you can take that first.
Yeah, so I would just say all of our like online fundraising tools, you know, for sure. So we've always pushed heavily. We have a relationship with Facebook where we're able to link to Facebook fundraisers through our participant center for our walks, so they can fundraise for their teams and their individuals through social media right on their Facebook pages. And we know the importance of that, and we always, you know, try to push the importance of that, but it definitely falls to the wayside sometimes in a normal fundraising year. Whereas this year, we really have heavily been pushing the importance of our Facebook fundraising tool and making tutorial videos. And anytime we're doing welcome calls for people, trying to walk them through how to fundraise on Facebook. We have stats that show that people who are raising money online through Facebook specifically, they raise like 4 times more than participants who don't. So we're really trying to push that information out to our participants. We also have a mobile app, which again is always a tool that we have and we use, but we've never had to rely on it quite as heavily as we have this year. So our mobile app lets people sign people up, take donations, that even people who are doing traditional fundraisers like letter writing campaigns and might pick up. That's not an option anymore. So instead of mailing those checks in, they're feeling a little bit more confident in just being able to mobily deposit them and not have to leave their house or meet with anyone in any way, shape, or form. So we've always had these tools, but we're really trying to just utilize them a lot more. And then we're trying to break into some things that we've never really had to use heavily in the past. So like live streaming, we know the potential for live streaming out there, and especially in our DIY fundraising program, which we call the Longest Day, we're actively trying to recruit a lot of live streamers and gamers to see more familiar in things like Twitch and, that we have not really heavily had to use in the past. So that's been a learning curve for us. And then we're really looking forward to utilizing some of the new things that are being put out by like Facebook, where they're also going to be able to connect to personal fundraisers, and you're going to be able to live stream together with people and, and take donations as, asking people if I can get to $50, I will run a mile or I'll do 20 jumping jacks or whatever, just trying to show people that virtual fundraising does not have to be as complicated and as scary as it sounds. And we actually have a happy hour on Thursday where we're inviting all of our team captains and our walkers to come learn about all of these tools that we have. And again, we've always had them, but it's just, we've never gone to these lengths to promote them as we are this year, because one, we have the time, and two, we have to. We just have to adapt, and we aren't able to meet people and help update their pages for them. So we're having a happy hour where we'll show people how they can update their personal fundraising pages, put their personal photo on there, tell their story, really make it unique. So when they email people, which again, they can do from the website, and we're going to show them how to do that. Or when they link to Facebook, it's going to have that really unique story, and people are going to be more likely to donate to it whenever they get that link. And then we're also showing them things like the Facebook live streaming, and helping people brainstorm other, socially distanced fundraising that might not be technology based, just to show people it's not as scary as it sounds. You could write letters if you want to. And there are ways to thank your donors and communicate with your donors that way. But it's definitely, we've always had the tools there, but we have definitely had to get more comfortable with them ourselves and host a lot of trainings, and training videos and one-on-one phone calls to walk people through how to use these resources that we have available. And it's a little preliminary, but we just did a big push for teams this week. And over the month of May, we have been consistently seeing teams sign up, and they are immediately linking to Facebook or making personal donations. So we've seen a decent number of self-donations and Facebook fundraisers come in over the month of May as we've been recruiting teams. Because again, as we're recruiting them, we're making sure they know about these tools. They're really at the forefront of any communications that we're putting out, whether that's a recruitment email or your welcome call or your welcome email. So people know immediately that they're out there and they're taking action with these little steps that they can do, and it is resulting in income.
Great. Thank you. And Nicole, what about you? Anything you guys were dabbling in that you use extensively now?
Yeah, so a few things that we had been talking about, and I think this just kind of gave you kind of the push to go after some of these things and really test them. One was thank you videos for donors. So just having our foundation president or our hospital president record a video on their iPhone and send it to us that we could send out to thank donors, be it for a specific donation for some of our major gift donors, or just a general video that could be put on social media or dropped into an email and sent out. So just those, we want to make it seem like it's candid, because it is, and we don't have big production crews and things like that. So just that really cell phone thank you video. Another thing we started doing, we've done a series on social media where some of the more common questions we get, like we just had a doctor addressing how to teach your kid how to wear a mask. We have been filming our doctors and then putting their answers on social media so that they're like talking to the parents. And that's been very popular and has received some good feedback. I was laughing to myself when you were talking about gaming, because at Children's, through the Children's Miracle Network, we have this thing called Extra Life that they had always been doing with games and streaming, and I knew nothing about it. I have now taken a crash course because I think we just have to get creative and think outside the box and realize that there's gonna, as we keep saying, there's gonna be a blend moving forward of trying some new digital technology, stepping outside that box, be it with getting doctors to do virtual meetings with donors, and figuring out how to make that personal connection when before we were used to meeting people in coffee shops and things like that. How do we make that personal, like they see you in your home so that there's the personal connection, but in a digital way. And so I think through the videos and things like that are kind of has been our focus.
That's great. Yeah, I've noticed that the innovative things that people are doing to instill that sense of presence that you would normally get in a physical environment has been amazing. And this whole area of video conferencing and everybody from their homes has really ushered in a new era of, you know, low production quality. You don't need to do anything fancy. You can do something on your cell phone. You can film your own, you know, even your own channel, you know, your own TV show from your house, and everybody's kind of just fine with it. It kind of works. That's great. It kind of brings me to the next question I have, which is, was there anything in this change in society that brought you new opportunities for fundraising? I mean, obviously you're using new tactics, new tools for fundraising, but was there any unexpected you know, resource of fundraising that came about? Chuck, do you want to answer that first?
Well, I think, you know, this issue, there's such a huge mental health component to this issue. And there's a mental health component for just every American who's has, you know, oftentimes struggling with more anxiety. There are the first responders who, you know, are actively engaged. So I do think it's opening up areas that we see, and I do believe it goes back to our mission of, you know, what are we in business to do, and it's to help people, you know, and to help people who live with mental illness and their families. So if there's one area, it could be the healthcare sector and the folks outside of the mental health system who are seeing patients every day that, you know, have increased psychiatric disorders and are living with it themselves. So I think that's opened up kind of a whole new area for us in interest, and we know that our donors are very, very interested in supporting those individuals. So that's probably the primary area.
Okay, great, thanks. What about you, Nicole?
So I think prior to this, a lot of people thought about Children's as the Children's Hospital and what we do within the walls of our hospital in terms of research and clinical care. This COVID really opened up and allowed an opportunity for us to educate a lot of our donors on what we were doing in the community that no one really knew about. We have places called Family Care Connections that are located throughout the Pittsburgh area, and a lot of times they're found in more underprivileged families. And when COVID hit, a lot of these families didn't have transportation, or they had limitations on going anywhere. And we were able to use philanthropy to take formula and diapers and just some basic needs to them. And so it's given us an opportunity to share with people who had been supporting Children's for years, to realize that we're out in the community doing some preventative measures as much as taking care of the kids that are sick coming to the hospital. So I think it opened up just a new area to educate the community and our donors on how broad our organization is.
Very nice, good. And Leandra, what about you? Any new opportunities?
Yeah, I think as we've transitioned to virtual programmatically, we've also have had a lot of really cool things happen. So we've had some programs, for example, like Project Vital in Florida, where we've been working with the Department of Elder Affairs and then assisted living facilities to get iPads into different assisted living facilities across the state to help with social isolation and keeping people connected to their families. Because as you can imagine, a lot of our constituents are in nursing homes and other assisted living facilities, and they haven't seen loved ones, and their caregivers have not seen them. So we've been working on some projects like that. And I think long-term projects like that are very different from what we normally do are going to help us in strengthening our relationships with assisted living facilities moving forward. So they've always been a huge supporter of ours, and we've always had teams with them, but I really just think things like this will help those relationships grow long-term. And then another thing, I don't necessarily think that we've seen any kind of like new fundraising coming out per se, but I think the creativity of our teams and participants has just really been able to shine at this time. And we've been surprised to see some of the things that they have been able to do. We had a participant who was supposed to be doing the Ironman in Hawaii in October, and that has been postponed. And he really had to transition. He has early onset himself, and so he was training for that. And he really has had to kind of move to a strictly social media campaign and asking friends and family to support him. And he has done tremendously well transitioning to Instagram, and he has a really great Instagram and following, and people are making donations through that. And I don't think that's anything that he ever really thought would come about because of this. I think he thought he just asked for some donations. He would sell miles for the Ironman in October. That's how he would get all of his income, and he would call it a day. And so far, the majority of his money has not come from selling miles. He's made personal donations and had some really large gifts from personal asks that he's made, and then has also had donations come in from his Instagram following of how he's training for the race instead. So we've really been able to see our participants adapt, and I think that has been really exciting for us because they're just thinking really creatively and doing things that we never would have thought of and that we never would have seen in other years.
That's great. We've been talking a lot about healthcare and COVID-19 is a healthcare issue. So, people are highly empathetic to healthcare needs right now. But for our audience, there are probably people that are not in the healthcare space. So what insights do you have or advice for our audience who are outside healthcare and are trying to still raise funds for education or training? Do you have any insights to that? Nicole, do you want to start us off?
Sure. So I think one of the most important things I've taken away from this is don't assume that you know what your donors want to do, or that, I had a donor who I thought was in a area where his business was taking a large hit, and he still stepped forth with a major gift. And so I don't think you can make assumptions on where people are. And while there are people who are supporting healthcare, and there are still other people who still want to stay involved and connected to the organizations that they have always supported, be it their alma mater or the local charity, that's just there in their community. So don't assume that you know where people are, and just have authentic conversations with people. I've been very real and transparent, and, a lot of times donors ask us what's next. We don't know. I think we're all living in this world where we don't know, and just being as transparent and authentic and just having one-on-one conversations, because that's what I have seen to be most effective, that I think translates across different sectors of the nonprofit.
Great. Leandra, what do you think?
Yeah, I would 100% agree with that. And I would also say, even though we are in healthcare right now, we're not COVID related, directly. So yes, our constituents will feel the impacts pretty strongly of COVID, and we are feeling that, but that's not really in our messaging. And so I would just tell everyone to lead with mission and to be careful to not pit causes against one another. This isn't a time to say why one cause is more important or why one constituent base might be more affected than another. I just don't think that anything like that is necessary, and you're probably just getting yourself down a wormhole if that's the messaging that you decide to lead with. I think it's important to really just focus on whatever your mission is, why that mission is still important now, not necessarily why it's more important than anything else, or even necessarily how it relates to COVID. There are a lot of organizations that might be thinking that they need to, somehow get their messaging to, why it's important now in relation to COVID-19. And I just don't even think that that's necessarily important. Just focus on what you're doing and why it still matters to your donors. Your donors cared about your mission before, they will still care about it now. And I would just lead with that in those personal one-to-one asks, and just really stay focused on why this is meaningful to whoever your constituent base is.
Great, thank you. And Chuck,
Well,
any insights for people outside of healthcare?
yeah, when all this happened, one of the things I did is I looked back at 3 events that had happened, and I actually have been at NAMI through all 3. 9/11, the recession, and Hurricane Katrina. And I took a look at the impact on philanthropy during those periods and after those periods. And I'd encourage the audience, if you're interested, there are various, the Indiana School of Philanthropy is a great source, and also the Center for High Impact Philanthropy at the University of Pennsylvania. And Penn did a study that really showed that philanthropy bounced back faster after the recession of 2008 than they ever thought. And that one of the areas was food banks, that food banks saw a 32% increase in donations during that time. The point that I think I'm trying to make is that I think what you have to do, regardless of what your organization does, is find how relevant you can be to your donors and your sponsors during this time. So you may not even think, well, I have a connection, but you really might. The way that we did this, and someone on the panel said that one of the things that they were very respectful and didn't do a lot of outward fundraising for a time. We did the same thing. We kind of shut down our fundraising. The first thing we did, though, is we did a survey of all of our donors. And we've done donor surveys before, and we get a few hundred people responding, probably 500 or 600. We did this survey, we got 7,500 people responding. And the response was incredible. It helped guide some of our programs, but it really showed us what the great need was there. So I think doing what you can to be relevant during this time and understanding what that means for you and your organization.
That's great. And that's a good recommendation for communication in general, is to always be relevant, right? And understand your audience and not assume about your audience, but actually poll them and do your research. So that's great. I do have one question. This came from the group. Does anybody know if there's resources at WVU or anywhere to put on a virtual event? Like when Nicole and Leandra, you're planning your virtual events, is there any guidelines or any toolbox that you found? Either one of you is fine.
I think we're all learning as we go. I think it's kind of an uncharted territory. As far as resources within WVU, I'm not sure. I know all of our virtual events are handled by our staff internally. So whether it's a Zoom platform or a Microsoft Teams platform, whatever we're using, it's handled internally. And we certainly look at other organizations and what's out there and what are best practices, because I think it's going to be a learning process as we go. But Leandra, you may know more.
I was just going to say, I was trying to find it real quick. The peer-to-peer forum had a COVID page that had a lot of collections of what different organizations are doing. And I think they also had a couple webinars as well. So I would definitely look up their website. I think it was just on the peer-to-peer forum. Just one of the tabs has like an entire COVID page of resources.
That's great. Thank you. Well, I think we are almost out of time here, so I'd like to thank everyone for joining us. Special thanks to Leandra Clovis, Chuck Harmon, Nicole Riggleman, Kelly, and for everyone on the session here, be sure to visit integratewvu.edu for upcoming sessions, recordings of previous episodes, and to subscribe to receive updates. I sound like a commercial. This has been great. I was really insightful, and thank you for sharing your experiences. I wish you all the best on your endeavors in the future year.
Thank you.
Thank you.
Thank you.
Take care.